outbreaks has been increasing since the beginning of October. In the last 2 weeks of November, there has been 12 new outbreaks opened in congregate settings. These outbreaks have been driven by new cases among staff. In the month of November, there have been 7 outbreaks tied to businesses across multiple sectors. Total number of cases from business outbreaks in November at 35, with a range from 3 to 12 cases. I anticipate that we will have more difficult days ahead as we grapple with the impact of rising cases in our community and around the state. It is inevitable in the days ahead that we will be in the regional stay-at-home order. We will then issue a local health officer order to remind everyone what is permissible and what is not allowed as soon as we receive notification from the state. In conclusion, I'd like to remind everyone that we still need to continue to wear our masks, maintain at least 6 feet distancing from others, wash our hands, and stop gathering with those not from our household. These are choices and behaviors that will keep everyone safe. Thank you.
Thank you, Dr. Dorvinoso. Dr. Henning Ansorg, the county's public health officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. I would like to take this opportunity and report a little more on our upcoming COVID vaccines and vaccination efforts. As most of you are aware, there are currently 2 vaccines in the review process by the FDA to receive emergency use authorization. Once the FDA grants this authorization, the Advisory Committee on Immunization Practices of the CDC, known as the ACIP, will review the original safety and efficacy data and issue their recommendations on utilization of these vaccines. We anticipate that the FDA will approve the Pfizer vaccine by the end of next week. ACIP, or the Advisory Committee, will likely need an additional 2 days to review all the science and give their recommendations. Pfizer already has a certain amount of vaccine vials ready for shipment. If all goes according to plan, Santa Barbara County is slated to receive an initial batch of 3,900 doses around December 18th. Due to the sub-freezing transport requirements, the shipments will go from Pfizer directly to our local hospitals and the Public Health Department. The Public Health Department has created an equitable distribution plan for the county to make sure that frontline healthcare workers will have access to the vaccine initially. This will be followed by first responders and elderly community members living in nursing homes who have the highest risk for developing severe disease if they are infected by the coronavirus. We will follow the prioritization algorithm that has been created by the CDC and the CDPH, which is the California State Health Department. A second vaccine developed by the company Moderna is expected to become available about 10 days later. So we might receive shipments of this Moderna product by the end of December or in the early days of January. There are several more different vaccines in clinical trials right now, and they will likely become available one by one in the early spring. Once our highest risk recipients have been immunized, the general public will be able to receive their vaccinations. Depending on the availability of more vaccines, we will be including pharmacies, primary care clinics, urgent care centers to our public health vaccination spots for this immunization effort. The Center for Disease Control on Wednesday updated their recommendations on the length of quarantine for individuals who may have been exposed to COVID. The recommendation states that it is still safest and the gold standard to complete a 14-day period of quarantine after contact with a COVID case. At times, when the 14-day period is not feasible, the new CDC guidance does allow for a shortened 10-day period with ongoing vigilance for symptoms until the 14 days are completed. The CDC even gives a third option for an even shorter 7-day period, providing a COVID test on or after day 5 results negative. For Santa Barbara County, we will not implement the 7-day quarantine option because the risk of still coming down with COVID after the 7 days, even with a negative test result, can be as high as 12%, according to the modeling data used by the CDC. We determined that this is an unacceptably high risk. The CDC gives the county health jurisdiction the authority to establish local quarantine options, and we decided to continue with 14 days as the gold standard and the safest time frame, however, allowing for a shorter 10-day quarantine in situations where 14 days are not feasible. Thank you.
Thank you, Dr. Ansorg. Suzanne Grimacy from the county's Department of Behavioral Wellness is also here today to tell us about the importance of getting outdoors during this very stressful time.
Thank you, Supervisor Hart. Yesterday's announcement of the regional stay-at-home order has only strengthened our need to continue to focus on our mental health. As the governor stated yesterday, getting outdoors and staying active will be critical, and he is so very correct. We couldn't be luckier than to live in a community where we have so many opportunities to get outside. Here in Santa Barbara County, we have easy access to hiking paths, outdoor areas for running. We have well-lit bike paths for day and even evening bike rides or walks. We have beaches, we have parks, and we have so many more opportunities. Getting outdoors is even more important now than ever before. There's growing research that tells us that even a simple walk outside can help to reduce depression and can boost our energy. So get out, keep a safe distance from others, keep your mask with you, perhaps carry an extra mask with you in case there's someone else who needs one. When you're out, be sure to notice the sights and the smells and the sounds of the outdoors. Walk your dogs. And if you get out in the evening, enjoy looking at the festivity of the Christmas lights that are hung around town on so many homes and businesses. Other reminders for taking care of our mental health: work breaks into your days. Take time to unwind, even if you have to schedule it. Limit your time watching or reading the news. Stay connected with others. And if you feel like you need extra support, reach out. Nobody has to do this alone. The Behavioral Wellness Crisis Access Line is available 24 hours a day, 7 days a week at 888-868-1649. And the Community Wellness Team remains available to call and get connected with mental health resources. That number is 805-364-2750. Lastly, a reminder for the seniors in our community or those who may know a senior, the Behavioral Wellness Department and the Community Wellness Team have launched a senior holiday phone bridge program. Recognizing that this time of the year is challenging for everyone for a lot of reasons, but for our seniors who look forward to time with family and visits, and so many that may be in skilled nursing facilities or other places where they can't have visitors, this can be an extra lonely time of the year. The Holiday Phone Bridge program pairs seniors that are interested up with a volunteer that will call once, twice, or on a regular frequency just for a warm phone call, for coping skills, for updates on COVID, or for ideas for activities during the season. So we encourage people to reach out to the Community Wellness Team to make connections to the Phone Bridge program. Again, the number is 805-364-2750. Thank you.
Thank you, Ms. Grimacy. We'll now go to questions from the room. Mr. Devine?
Just to clarify, Supervisor Hart, when you said if the regional stay-at-home order is triggered, would it be 24 hours till businesses have to shut down, or 48 hours?
24 hours.
Okay. And then another question I have is, obviously, we're in December, Christmas is coming, and what can people do today to save Christmas so it's somewhat normal as opposed to what we anticipate it could be like if the cases continue to rise? Or is it already too late to have a normal Christmas?
This is not a normal year, and that includes all the holidays, and unfortunately we're in a position today where we're looking at a shutdown order, and that will continue, if that occurs next week, early next week, that will continue through Christmas, and we're just going to have to figure out other ways to connect with family and friends in meaningful, real ways that are not personal and in contact with each other. There is no other option, and there are lives at stake at this point. 1,000 Californians died in the past week alone. That is the beginning, not the worst case scenario. As cases continue to spike, and we have not felt the impact of the Thanksgiving gatherings that occurred. And so maybe that's the bottom line, is people should think about the consequences of gathering with family members and the importance and necessity of that. But the potential consequences of that are far greater. The fact that you wouldn't have a family member's birthday to celebrate next year because you chose to celebrate Christmas this year is, in my mind, not worth that trade-off.
And if the governor issues that regional stay-at-home order, which we're all expecting very soon, what would this mean for modified holiday events across the county? There's a lot of events going on physically distanced, but would those all have to get shut down?
The shutdown order is a stay-at-home order. If it is triggered, folks have to stay home and only go out for essential trips.
And then over the summer, the Board of Supervisors agreed to lease that old Sears building in La Cumbre Plaza so it could be used if hospitals reach capacity. Where does everything stand with that alternate care site in the county right now?
What we've learned in that time since that was contemplated is that the biggest limitation on hospital ICU capacity is actually staffing, not the physical space. The hospitals have a flex capability in their buildings to add ICU rooms. But as the virus has gotten out of control across the country, staffing has become a critical issue, and that is a limitation that we have to exist with. We can't train nurses and ICU emergency doctors in the next couple of weeks. So we're the only strategy we have is to reduce mixing, to reduce the spread of the virus, to maintain capacity in hospitals to protect against that surge.
And then lastly, my two questions for either of the doctors, but will Santa Barbara County take patients from other counties in our region if the counties get hit hard with their ICU capacities?
I think that is a complicated question, and we as a region have been very supportive of one another in the counties. And if we have the capacity, I believe that the hospitals will attempt to accommodate, keeping in mind to also safeguard the available beds for our local residents.
Thank you.
Thank you, Mr. Devine. We'll now answer questions on the phone.
Yes, first up is Tom Bolton with Newshawk.
Thank you very much. I'd follow up on Blake's last question. Do you have a census of how many patients either have been sent here or are currently here from other counties?
Do you?
About 10 days ago, we College Hospital accepted 2 patients from Imperial County that were needing ICU care. But because of our rising cases, the local hospitals decided to no longer accept more patients as of right now.
Okay. My second question, I'm hearing a lot of people questioning why Santa Barbara County was included in the Southern California region with counties such as Riverside and San Bernardino and Imperial, which obviously have much more serious situations. Not to minimize what's going on locally, but I'm wondering, in your judgment, how appropriate you feel it is for the county to be lumped in with those Southern California counties.
I think that's the natural first reaction that everyone has had, is that given the caseloads in Los Angeles County, the reaction is disappointment and frustration that would be included in that larger Southern California region. But when Dr. Dorvinoso and her team looked at this more carefully, the Southern California region is actually in the middle of the trend statewide. The worst area in the state in relation to ICU capacity is actually rural Northern California. And the Bay Area is doing the best. But the range between the best and the worst is a little bit, about 6%. So it fundamentally doesn't change where we land in relation to other counties if we're going to be lumped into a larger region for the purposes of distributing medical capacity across a broader area. So while our individual case count today is much better than those places, that is not a certainty to stay that way over a relatively short period of time. There's been tremendous change in a very rapid period of time. So, I think what we are focusing our efforts here locally on is working with the California Department of Public Health to figure out an exit strategy. When the shutdown occurs, we want everybody to comply. We want to keep our case numbers low. We want to keep our hospitalization as low as possible, so that when there is an opportunity for that to end, that we can quickly get back on track and reopen businesses. But I understand and empathize and felt exactly the same way when I first learned that information.
Yeah, I guess it all makes sense, Greg, but I'm wondering whether, as the public health department officials particularly, if they agree with that approach of just grouping these very large regions all together when, up until now we've been looking at it on a county-by-county basis in terms of the tiers and other ways of deciding, what level of shutdown was going to occur.
So a few months ago, when the state anticipated that we would need to reach this point of a regional approach, they did ask both Dr. Ann Sorg and I to weigh in, and there was a survey about between 3 different options for regionalization. And we had voted that it makes more sense for us to be grouped on a smaller scale, perhaps along the Central Coast counties, given the similar economies, size of population, and whatnot. But alas, given the other more broader implications of a bigger regional access, regional capacity, the ultimate decision was to go with the 5 health officer infrastructure coalition as a region.
So I'm understanding that you all advocated for a much smaller regional, perhaps a Central Coast, but were essentially overruled by the state?
That is correct.
Okay, thank you very much.